Before I begin my assessment, I will do a 365 scan of the room. I'm now going to wipe down my stethoscope with an alcohol wipe. I will now perform hand hygiene. And now I'll put on my gloves. Now I will introduce myself to my patient. Hello, my name is Skylar. I'm a student nurse and I'm going to be performing an assessment on you today. Is that okay? Okay, perfect. I'm just going to close the curtains to provide privacy. Can I please see your ID band? Thank you. Can you please state your name and date of birth? Thank you. Do you need to use the washroom before we begin? Okay, perfect. Can you please stand up and sit back down? Thank you. So her height is within normal range for her age, and her color of her skin is symmetrical and even throughout her body. She appears the age she has stated. Her speech is normal. Her facial expression is normal. She appears well nourished. She maintains eye contact. There are no physical deformities. Her body is symmetrical on both sides, and she maintains eye contact, and her posture is straight with her arms by her side. I will now assess your gait and range of motion. Can you please flex your elbows and extend your elbows? Thank you. Can you please stand up and walk to the other side of the room and back? Thank you. Her gait and range of motion is good and normal. Can you please breathe in and out for me? Thank you. Her breathing is normal and there are no signs of distress. Can you please state where you are, the place you are at, and the date? Thank you. She appears alert, awake, and she is well oriented. I'm now going to inspect and palpate your head. Is that okay? Okay, perfect. So as I can see, the shape is normal. There are no lumps, lesions, or deformities or masses. The hair is consistent in color, and there are no signs of infestations. I'm now going to assess your face. Is that okay? Okay, so her face is symmetrical on both sides. There is no involuntary movements, masses, or lesions. And it is intact. And there is no scarring. I'm now going to assess your cranial nerve 7, which is your facial. Can you please smile for me? Show your teeth, frown, raise your eyebrows, shut your eyes tightly, and puff out your cheeks. Perfect, thank you. Her face was symmetrical when performing these. I'm now going to assess your eyes. Is that okay? Okay, perfect. So there is even lash distribution. There is no crusting, discharge. There is no masses or lesions, as I can see. I'm now going to measure your pupil size with my pen light. Perfect, thank you. Perfect, thank you. So her eyes are symmetrical on both sides, and they are even. I'm now going to assess your consensual light reflex and your accommodation. So if you could please look straight ahead as I do your consensual light reflex. Thank you. So both of her pupils constrict. I'm now going to test for accommodation. Can you please look at the top of my finger? Her eyes are dilated, and as I move closer, they constrict and converge. Thank you. Her eyes were symmetrical when performing consensual light reflex and accommodation. I'm now going to assess and palpate your ears. Is that okay? Okay, perfect. So her ears are symmetrical. There is no discharge or crusting or lumps or lesions. I'm now going to palpate your auricle and tragus. Is that okay? Perfect. Is there any pain? Okay, perfect. There was no tenderness when I palpated the auricle and tragus. I'm now going to perform the whisper test on you. Well, I will whisper 3 words into each ear and you'll have to repeat them back to me. Thank you. Thank you. She repeated the words back to me successfully. I'm now going to palpate your nose and sinuses. Is that okay? Okay, so first I'm going to palpate your frontal sinuses. Is there any pain? No, perfect. Now your maxillary sinuses. Is there any pain? No, perfect. I'm now going to assess your mouth. Is that okay? Just gonna grab my pen light and my tongue depressor. So her lips are pink in color and they are hydrated. And there are no lesions. Can you please open your mouth? Her hard and soft palate are intact and there are no lesions and they are both intact. Your teeth are white in color and there is no looseness. Her tongue is hydrated and midline and pink in color. There is no swelling in the gums. And it all seems normal. And there are no lesions in the gums as well. I'm now going to assess your cranial nerve 9 and 10, which is your glossopharyngeal and your vagus nerve. Can you please open your mouth and say, ah? So her soft palate and uvula rise when she says, ah. I'm now going to assess your cranial nerve 11, which is your hypoglossal nerve. Can you please say, light, tight, dynamite? Perfect. She performed this test successfully. I'm now going to inspect and palpate your neck. Is that okay? So there are no pulsations. It is symmetrical. Her trachea is midline. There is no lesions, scarring, or masses or lumps. I'm now going to palpate your carotid artery. Your carotid arteries. Is that okay? Okay, perfect. I'm going to palpate one side at a time. Perfect. So the rhythm on both sides is strong and intact. I'm now going to ask you to raise your shoulders against resistance. Thank you. Can you please turn your head against resistance? And the other side against resistance. Thank you. So she performed this test successfully with going against my resistance. I'm now going to assess your upper extremities. Is that okay? Okay, so I'm going to roll up your sleeves. So her arms are symmetrical on both sides. There is no lesions, masses, pulsations, involuntary movements, and it is intact. I'm now going to palpate your arms. So the temperature is warm. There are no masses, lesions, or involuntary movements, or there is no scarring or anything like that. I'm now going to check your nails. So the nails are consistent in color and the shape is normal. Can you please grip my hand? So the grip is firm and intact. I'm now going to assess some range of motion with you. So if you could please put your hands in prone, supine. Can you please flex your fingers, extend your fingers, flex your wrist, extend your wrist, flex your elbows, extend your elbows, adduct the arms, abduct the arms, radial deviation, ulnar deviation, shrug your shoulders, relax your shoulders, external rotation, and internal rotation. Perfect, thank you. I'm now going to assess your radial pulse. Is that okay? So the pulse is strong and it is normal. for an adult. I'm now going to assess your lower extremities. So as I can see, the shape is symmetrical. They're symmetrical on both sides. There are no pulsations, involuntary movements, scars, lesions, or masses. I'm now going to palpate. So the temperature is warm. There are no involuntary movements, pulsations, or anything like that. There are no lesions, masses, or scarring. I'm now going to assess your PDS pulse and your tibialis pulse. So your PDS pulse is located right here on the foot, right here. And her tibialis pulse is located right here. The posterior tibialis pulse. Okay, perfect. I'm now going to assess your plantar and dorsiflexion. So if you could please flex your feet and extend your feet and point your feet. Thank you. These were performed normally. I'm now going to perform hand hygiene and get new gloves. And I'm going to get new gloves and put the new ones on. Okay, I'm now going to assess your thorax, your posterior thorax. So if you could please turn around so I can assess thorax. So as I can see, the color is consistent. There are no lesions, masses, pulsations, involuntary movements, or scarring. I'm now going to measure the ratio. So that is 1, and across is 2. Therefore, the ratio is 1 to 2. I'm now going to palpate your posterior thorax. Perfect, thank you. I'm now going to auscultate your posterior thorax with my stethoscope. Please breathe in and out, in and out, in and out, in and out. Perfect, thank you. Her breath sounds are normal and equal. I'm now going to assess your breaths per minute. So if you could please sit like this. I'm going to listen to your breath sounds for 1 minute with my second hand watch. Perfect. Your breath is about 14 breaths per minute, which is a normal finding for an adult. I'm now going to listen to your anterior thorax and the valves of your heart. Okay, now I'm going to listen to your aortic valve, which is the second intercostal space on the right. Now I'm going to listen to your palmic valve on the left second intercostal space. Now I'm going to listen to your mitral valve or tricuspid valve, which is the fifth left intercostal space. Now your mitral valve, which is the fifth right intercostal space, left intercostal space. And the third intercostal space is Erb's point. Erb's point. Thank you. Perfect. All right. Now I'm going to assess your apical pulse, if that is okay with you. And I'm going to, with my stethoscope, I will do the apical pulse and for 1 minute with my second hand watch. Okay, so you have about 80 beats per minute. The rhythm is regular. That is a regular finding for an adult, and there are no extra heart sounds. Now I'm going to explain where S1 and S2 are best heard. So S1 is best heard in the mitral and tricuspid listening posts when the valves close, and S2 is best heard in the pulmonic listening posts when the valve closes. So now I'm going to assess your abdomen, if that was okay with you. Okay, perfect. Can you please lie down? And I'm going to drape you this and pull up your shirt. I'm just going to move the camera. Okay, so what I'm going to do first is I'm going to assess your abdomen. So as you can see, there's no scars, lesions, it is symmetrical, the color is consistent, there are no masses, scars, or pulsations. I'm now going to listen to the 4 quadrants of the bowel sounds with my stethoscope. Okay, perfect. Now I'm going to palpate your 4 quadrants of your abdomen. Is there any pain? Any pain? Any pain? Okay, perfect. Now I'm going to palpate your bladder. Is there any pain there? Okay, perfect. There's no tenderness or masses in the abdomen. You can please sit up now. And that concludes our assessment. Thank you so much. Thank you for watching.